I think when I was first diagnosed, it was as a result of some finger stick immediate right now blood sugar readings, and I was probably in the mid 200s at that time. I think the first hemoglobin A1C test we did, the result came back in the mid 9s. As a comparison, the last hemoglobin A1C test that I did for Dr. Marcantel just a few weeks ago, we came out with 5.4, which of course is right on the high edge of the normal readings. So we're very pleased with the results there. My fasting blood sugars are typically in the under 110, in the 95 to 105 range more typically, which for a guy with that's in his late 60s with the kind of diabetic symptoms that I had 11 years ago, I'm considering that well managed. I think it's kept us out of the extreme dosages, and it's also kept us from having to go towards some of the more aggressive medications. Metformin and glipizide are probably the two most benign and conservative of the diabetic medications, and if we could, we just had a pretty strong feeling that if we could keep it there, that we didn't necessarily want to go to some of the more aggressive products available, and that's been the case. When I first saw Dr. Marcantel, I was probably near my all-time heaviest weight, and I had never broken 300 pounds, but I have bent it severely, as I used to say. I'm about 40 pounds lighter than that today, and I think that's a direct result of some of the things that I learned from Dr. Marcantel about making good nutritional choices. The closer I stick to the meal plan that she's laid out for her patients, the better off I am, and the better I feel, the more payback I get. If this weren't giving a payback, I wouldn't be doing it. I would be doing something else. I could have all kinds of medications, and there are all kinds of other treatment options out there for diabetes. The consequences, though, of some of those have led me to believe that if the more conservatively we can treat this disease, the better off it's going to be for me in the long run, in terms of managing its symptoms, long life, and just better health overall. The compassion that has shown through Dr. Marcantel's practice in the 11 years that I've been associated with it have led me to believe that she is a genuinely compassionate person with a lot of skill, a lot of knowledge, and a real passion for passing that on to people for their own education, for their own self-awareness, self-knowledge, and empowerment to make better decisions about how to positively impact their health care.